Welcome back. Well, mosquito bites are never fun, but they can be more than just annoying, and Jen Tome is here with more about EEE this afternoon.
Well, Liz, it stands for Eastern Equine Encephalitis. It's a rare illness in humans, but if you do get it, it can be deadly. Severe cases of AAA begin with flu-like symptoms and can progress into a coma. And today's House Calls, Dr. Mireye Wessolossky, an attending physician in infectious disease at UMass Memorial Medical Center, joins us live via Skype. Doctor, we've had a lot of rain in March and April, and there are a lot of mosquitoes out. Is there an increased risk for AAA?
Definitely. We know that during spring, early spring, when it's a heavy rainy period, there is more water, more swamp and fresh water for the mosquito to breed and have a lot of larvae that are becoming adult mosquitoes. So we are going to see, and already we are experiencing a lot of population of mosquitoes around. So the chances for EEE may be higher because of the heavy raining during the March and April season month.
So what kind of symptoms should you look out for AAA?
Well, usually fever, high fever with headache, sensitivity to the light. Some patient may experience confusion, nausea, vomiting, body ache, like a flu-like symptoms. When that happen, if all these symptoms and signs occurs, patient should go and seek medical attention immediately to be evaluated for any signs of meningitis or encephalitis, especially if they have altered mental status or confusion or disorientation, they don't know where they are, they have cognitive issues, they should immediately seek medical attention.
What other types of diseases do mosquitoes carry?
Well, it depends where you are located. Mosquito can carry many diseases, but in New England, the other infectious disease viruses that can be transmitted is West Nile virus, AAA, which is the Eastern Equine Encephalitis. But if we are located in a tropical area, then you can have malaria, dengue, and other type of virus that we are not seeing in this area.
So West Nile virus has been around here. Are the symptoms similar to EEE?
You mean the West Nile?
Yes. Are the symptoms of West Nile similar to AAA?
Yes, they are similar. There's some subtle difference, but essentially the body ache, the fever, the headache can be very similar to EEE. So West Nile and EEE has to be into the differential diagnosis when you evaluate a patient who has headache and fever and flu-like symptom with body aches and etc.
Well, what can you do to reduce your chances of getting mosquito bites?
Well, the most important thing is to try to be away from the time that the mosquito has more activity, which are the dusk and dawn, and there's where they are more active looking for humans or animals to bite for their cycle. They need to suck blood to get their body warm, and that way they can't breed. So being away from that time is important, but also using repellents, mosquito repellents. There are many types of them. If you go out for a long time, you have to try to use long-sleeved shirts or big trousers. Tuck your socks and make sure that you don't have too many skin exposed that the mosquito can bite you. Use repellent over the clothes and also over the skin that is exposed.
Okay. Well, thank you, doctor, for joining us this afternoon.
You're welcome.
Now, if you have a question about EEE or another medical issue, email us at housecalls@cbs3springfield.com.